Okay, sir. Shall I start?
Please.
Please.
Mohan Raj, sir.
Please, madam, you can start.
Yeah. Very good morning to one and all. Honorable guests, the distinguished invitees, the eminent speakers, and my dear colleague friends. Myself, Varlakshmi, the Vice President of Indian Pharmaceutical Association, Anantapur branch, and I will be acting as moderator for this second day of IPA Annual Convention 2021. It's my pleasure to welcome all the participants today for the second day of IPA Annual Convention 2021, organized by IPA Anantapur branch. I welcome all the eminent speakers and guests from all over the country and from other countries too, who have come on the platform to share their knowledge and vast experience. Indeed, we are proud to announce that the first day of the convention is being conducted in a successful manner with the cooperation of all the eminent personalities from the pharma field. We are grateful for that and thanks, and we convey the regards from IPA Anantapur branch. Without further delay, let's start the second day with the plenary session 3 as per the schedule. I take it great pleasure to introduce Mrs. Manjuri S. Gareth for this plenary session 3. She is the Vice President, International Pharmaceutical Federation, and the Vice President and Chairperson CPD, Indian Pharmaceutical Association, India. It's my pleasure to introduce her to this gathering. She served as Vice President and Chairperson for the Community Pharmacy Division of Indian Pharmaceutical Association from the year 2012. And it's proud to say that she's the first woman Vice President of IPA in its 75 years of tenure. It's a proud achievement to be remembered. Congratulations, ma'am. And she also served as the Vice President, Community Pharmacy Section of Indian Pharmaceutical Federation from 2012 to 20, and also as Project Leader, IPS.TB Pharmacist Project under Public-Private Partnership Project since the year 2005. And also as Project Leader, IPA campaigns for awareness on responsible use of medicines since the year 2014. Not only this, to her credit, she received many international awards like International Award from Fellow of International Pharmaceutical Federation, received this honor for contribution to the pharma profession in the year 2016. And also she is the recipient of Ishidet Award from Federation of Asian Pharmaceutical Association for her extensive contribution to the community pharmacy in the year 2018. And also, there are many professional contributions continuously in her career, like she acted as the resource faculty or the coordinator for training of practicing pharmacists at national and international level, and also member for core committees of Ministry of Health and Family Welfare. She served as inspector for Pharmacy Council of India and inspected many of the institutes in and around the nation. She also a pharma columnist on consumer of medicine awareness and health related issues and authored a book too. Along with that, she has working consistently from the year 2002 in the area of community pharmacy and consumer education, and also works with all the sectors like academia, chemist associations. Along with that, she has served in various capacities and is known for her innovations in teaching pharmacy students and involves the students actively in various health projects. And also, she likes for budding and practicing pharmacists to train them in various aspects. She served as invited speaker and panelist at various international and national conferences regularly and visited for her professional work in various countries too. She is the recipient of several awards from various professional social organizations and also appreciated by media as a woman on a mission by Hindustan Times. With this brief introduction, I welcome ma'am for this plenary session free from IPA Annual Convention 2021. We welcome you, ma'am.
Thank you so much. Thank you for this kind introduction. And
thank you. Welcome.
Thank you. Thanks for the invitation, Dr. Ramalingam, and all the IP, Dr. Mohan Raj, and all the organizers. And I'm very happy to see all of you here, as well as my colleagues like Raj Vaidya and office bearers from various state branches, principals, and many more will be watching later on YouTube. So thank you again, everyone. And in this session, a brief session, I'll be talking about where the pharmacy is going, how it is transformed in other countries, and where we are and where we want to go. So reimaging pharmacy, and I really like this theme. Congratulations for this theme. And so I just add to it, reimagine tomorrow. So before I go forward, I just want to bring to everyone's notice, and I listened to yesterday the sessions by Dr. B. Suresh, a wonderful session, as well as by Dr. T.V. Narayana. And both of them were saying the same thing, that we all the pharmacy profession is all about making of medicines to making medicines work. So pharmacists are involved in not only in the research or manufacturing of the medicines or marketing of medicines or quality control, but also in making the medicines work. If we want a real benefit, if we want a real expected therapeutic outcome from these molecules, what is needed is again the services of the pharmacist. So we have the spectrum, the whole range of activities under our belt, and we are really proud of our pharmacy profession, how we are bringing the change in the lives of the patients, how we are making the difference in the lives of our patients. So when I speak, I'll be focusing more on how the pharmacists are making medicines work. That means all of you must have got it. That is, I'll be focusing more on the pharmacy practice. Now, the pharmacy practice, more so I'm talking about the community practice, that the pharmacist in the retail pharmacy sector, the community pharmacy as it is called world over. Globally, the focus has totally changed for the community pharmacy. And it is not product centric, that is, it is not just medicine selling, but it is person centric. People are talking about pharmacists not as medicine seller, but rather as a caregiver. And this is very, very important to keep in mind. And if you see the services abroad in community pharmacies in different countries, the developed nations in Europe, Australia, nations like Australia, UK, USA, Canada, and also many of the Asian countries, we can see a variety of services offered by the pharmacists, like medicine utilization review to vaccination, and also various health promotional services. When COVID-19 pandemic started, and then a year after when we had the COVID vaccines, I'm very proud to say that COVID vaccine is administered by pharmacists in the community pharmacy setup, at least in 30 countries around the world. So one of the first countries where the pharmacists started vaccinating COVID society is the United States. Then also many European countries, even Philippines. And so these are the pharmacists, these are the countries where the pharmacists are vaccinating the people with COVID-19 vaccine. Actually, a few years ago, the vaccination services started from the pharmacies, like flu vaccine. And now COVID vaccine is also administered through these services. So the pharmacy practice abroad has gone far. It's in the forward direction, and it has progressed so much, and the pharmacist services have expanded. So there are product-centric services. Of course, compounding is also there to some extent. Selling of medicines, dispensing of medicines is there, up to collection of expired medicine services. Emotional services are there. The primary health offered. Then medicine management, new medicine reviews, management of anticoagulants, or specialized services like diabetes management. These services are given by the pharmacists, offered by the pharmacists for the community, as well as the harm reduction services like opioid substitution, methadone program, or syringe exchange program. Even these services are offered by the pharmacists. Along with that, the point of care tests, measurements, all these variety of services and such expanded scope of practice is seen in the pharmacy practice in many countries. And along with that, now with the fourth industrial revolution, we can see the digital healthcare tools, the practice. These new things, the e-health, m-health are coming, and plenty of use of these services, these digital tools, these sophistications, these automations. And of course, you have to invest in that. When you're using e-health resources, the investment is there. And also new learnings are there. But then the patient connect, the way pharmacist is connected to the patient in offline mode, in online mode, virtual mode, actual mode is tremendous. And so we can always understand why pharmacists are going digital is always because patient involvement is considered as an investment and not as a cost. So it always leads to improved patient care services as well as improved business for the pharmacist. In different countries in the community pharmacy sector. Now let's come to the medicines. How are medicines used abroad or in India also? The WHO fact sheet reveals that more than half of all medicines are prescribed, dispensed, or sold inappropriately, and that half of all the patients fail to take them correctly. This is not a new knowledge. This fact sheet has been there for many years. That means what we learn from here is there are a lot of things that can be improved in this area by the pharmacist, by the pharmacy profession. We are actually, we don't know what is the gauge of the problem. We have not gauged the gravity of the problem of a responsible use of medicines in our country. But we know it is a serious issue. And there is overuse, there is underuse, there is wrong use of medicines, very much common in our country by the uneducated as well as educated people. Because health literacy, medicine literacy are not yet common. The role of the pharmacist as a patient counselor or giving all these patient-centric services, as I told you, has not evolved. And of course, there are many other issues like law implementation is an issue. Education is not orienting us yet to these type of services. It's not empowering us, it's not improving our capability for all these type of services. So the entire ecosystem needs to change. But this is where we are right now. So the pharmacist actually has tremendous scope because the medicine consumption in the country is increasing. Medicine usage has a lot of issues, so we need to improve on that. The medicine consumption is increasing because of obviously the increasing lifespan of the citizens, and we have huge aging population. Aging population means multiple medicines, multiple coexisting conditions. And so the medicine usage is increasing like anything. We have non-communicable diseases, which are very common. We have a lot of infectious diseases in the country, like tuberculosis we are topping. In NCDs, diabetes we are topping in the world. Not a proud, not a proud fact to say, but that's what is the fact. Then along with many other infections, which we already have, like tuberculosis, malaria, Now we have these pandemics like COVID, and they say that these type of pandemics may come recurrently or may just stay here. So the pharmacist has tremendous scope, and the society needs services of the pharmacist in various capacities. There is huge potential and there is tremendous scope. Along with these, we can also see there is shortage of healthcare workers in the country. If you see, especially rural parts of the country, we don't have enough doctors. We don't have enough other healthcare workers. And there the pharmacist services are vital, are imperative for the public health. So all in all, pharmacists have, we have a lot of challenges, but along with that, we have a lot of opportunities. So the other flip side of the challenges is always opportunities, or vice versa. So pharmacists can play important role, significant role in the healthcare and society. The patient, the consumers need the services of the pharmacist in different society, in different capacities. During COVID pandemic, pharmacists in every sector, in community, in the hospital sector, as well as of course industry, marketing, they have played tremendous role. And the pharmacy profession has demonstrated its real value than ever before during this pandemic. But somehow the pharmacists were not given the recognition that they deserve, at least due to this during this COVID pandemic. Whatever work they have done is phenomenal. But pharmacists as frontliners were not given that recognition, except one of the ministers, Honorable Minister, Mr. Nitin Gadkari, who appreciated, he tweeted. Otherwise, pharmacists were not given that status of corona warriors or frontline healthcare workers. We know pharmacists were not involved in the priority list for vaccination, COVID vaccination also. So pharmacists have remained somehow unsung heroes, even though they have demonstrated their value. But why? When we introspect, we realize why it is so. Because over a period of time, pharmacist services there is not enough evidence for the government to recognize our services, even though we are doing good work in isolation, but not as a consistent, not as an integrated service. So we need to do a lot more. Now, when in other countries, I showed you a few pictures of the other countries where the pharmacy practice has advanced to an extent which is like kind of unimaginable for us. What did these countries do? Were they not in the same status as we are right now? Yes, maybe 30, 40 years ago, they were definitely there in this situation where we are. Of course, our socioeconomic conditions differ, so we cannot compare that. But the pharmacy practice had not evolved, say, 3 decades ago. What did these countries do? How was the roadmap made and action plan made by them? And how did this pharmacy practice transformed in those countries? So basically, always the focus would be what are the needs of the nation? What are the population needs which are unmet? So the population needs assessment is extremely important. And then we have to see in that space where the contribution of the pharmacist will be. Where are the pharmacists fitting? What are all the services pharmacists can give to the society? So need assessment and then deciding what role pharmacists can play, what competencies should be there. That is extremely important going forward. And then we have to see, of course, the legal framework. What legal framework do we have? Then we need to change it. Do we need to change it? Then if we need to change it, yes, we need to bring the changes and then strictly implement whatever new laws are there or the existing laws are there. And in heart of this change, what is needed is the change in the education, because we need to prepare the workforce, which is empowered, which is capable, who is motivated to give the patient care services, to bring the change in the lives of our patients. So the workforce has to be prepared for that. That means the education has to play an important role. And so we need to see what changes we need to bring in the education. So these countries did that, and then they brought the changes in the contents of the curriculum, the delivery of the curriculum, the quality assurance of education was done. That's how they could bring the change in the workforce. And of course, the other things which are important for us is consumer sensitization, interprofessional working, because still very, very in a limited way, we are working with the doctors or nurses. So interprofessional working is also very important, and continuing professional development programs, making it mandatory, that is very important. So there are many factors, but overall, other countries went through this, and that's how they brought the change in their pharmacy practice. And that's why now the society is so much benefited by the services of the pharmacists, and pharmacists are recognized as healthcare professional, and they are a very proud professional serving the country. So in our country, it's not that everything is like nothing has happened. We have moved forward, and there are some positive developments. Just to mention few, maybe there are few more, but of course there are some positive developments, like Pharmacy Council of India released the Pharmacy Practice Regulations 2015. That is giving us a solid foundation for the patient care services, healthcare services of the pharmacists. Recently, the post of clinical pharmacist is created in the government hospitals. So that notification is also very much significant. The change is coming in the syllabus. After 3 decades, the syllabus of diploma in pharmacy is changing, and year 2020 is coming. So D-Pharms are the ones who are serving mainly the society. They're working as community or hospital pharmacists to a large extent. Not that B-Pharms and PharmDs are not there, but that number is still small, and you all agree that the D-Pharm is the main, the diploma holders are main the ones who are in the serving the profession as an interface of the profession. So this syllabus is changing. That is definitely a welcome change. Then there are many continuing pharmacy education programs which are arranged by different state pharmacy councils, Indian Pharmaceutical Association, other associations. There is also increasing advocacy and activism across the country. Believe me, in last 5 to 7 years, the way advocacy is done by different associations, small pharmacist groups, and activism also by individuals, that is commendable. I mean, because of that, there is a lot of attention to the pharmacists, lot of attention to what are the issues of the pharmacies, and that is really, again, a welcome change. And this kind of lobbying, this kind of, I mean, in a good way, advocacy is very much needed to take the profession forward. So there is increasing media attention. Even in social media, you see a lot of things discussed, and there is improving consumer awareness. Along with that, we are getting more attention and support from different international organizations like FIP, and their mentorship is very important for us, very valuable for us. So when we are talking of transforming the pharmacy profession or pharmacy practice in particular in our country, I would bring to your kind attention the development goals released by International Pharmaceutical Federation, FIP, in September 2020. These goals talk about education, pharmacy practice, policies and regulation, as well as the sciences. So the sciences, practices, education have to work hand in hand to bring about the change in the profession. And these are the goals, like these are 21 goals. If you go through it in detail, like people-centered care, patient safety, policy development, building the academic capacity, quality assurance of education, everything is very important for India. We need everything. And FIP has given mechanisms for the implementation of these goals. So implementation of these goals will bring the change in pharmacy locally, regionally, and globally. That's why these goals are released. So we have to make a plan for next 1 decade, how we are going to try to implement these goals. I know it is not easy. I mean, it is going to be baby steps that we will be taking, but the journey of 1,000 miles start in a small way. So we need to do that. So I invite you and appeal all of you to go through the FIP website and also go through all the FIP digital events, because that gives us a lot of knowledge, that gives us a lot of motivation, and that can increase our imagination how our pharmacy profession should be in our country. So please go through FIP website whenever you can. It is very important to do the imagination. Imagination can bring the transformation. If we never imagine what we want or where we want to go, the transformation can never come. We should see the dreams. I remember the poem by Rabindranath Tagore, where he says, imagine the world where the mind is free from any fear and there is knowledge. So something like that we need to imagine for our pharmacy profession to bring the transformation. So I always imagine the pharmacy profession and our country as where everyone benefits from access to safe and effective medicines and pharmaceutical services, where the pharmacists are recognized and respected as healthcare professionals, and where all sectors of pharmacy are united together and are acting together with one goal, with one focus, and that is building healthier society. And that's what should be our goal. It is always said that the power of the molecule is released by the hands of the pharmacist. So colleagues, those hands are ours, and we are all existing for only one client, and that is our people. So we are all there because people fall sick, they need medicines, they need our care. So we are all there existing for the people. So people-centered care, person-centric care is extremely important. So we need to imbibe that in our mind, and we need to go forward in whichever sector of pharmacy profession we are. Whether we are a student, we are an educator, we are in pharmacy practice like community or hospital. Basically, we are all pharmacists, and we are existing only for the patients. So it's very important to love our profession, very important to be proud of our profession and celebrate the profession. So when I'm ending my talk, I just want to bring to your kind notice that there is an opportunity to celebrate the profession, appreciate the profession, appreciate the services of the pharmacist, and that is 25th September, the World Pharmacist Day. And this is the theme, Pharmacy Always Trusted for Your Health. The theme can't be any better in this COVID pandemic. So we can all celebrate our profession, and let's be very proud to be a pharmacist. Thank you very much again for this invitation and for patient listening.
Thank you so much, ma'am. It was very nice and very brief presentation. Really, it was very pleasant to hear too. What you have discussed is the positive development. What you highlighted in your presentation last 7 years definitely is going to build the confidence in the student participants who are streaming in the YouTube. Yes, I truly agree with you too. That is, imagination can bring the transformation in the individuals. Thank you so much. Not only that, each and every word of what you have presented is very crystal clear, and it definitely reaches the student participants too. Yes, we are proud of our profession, and we will definitely celebrate our profession. Thank you so much, ma'am, for joining us on this particular scientific session. We extend our thanks and gratitude for being here. Though you have a lot of commitments for the today, you have spent your time with us. Thank you so
Thank you.
much.
Thank you
Madam,
very much.
I'll add few words.
Yes, sir, definitely.
Madam, thank you very much, ma'am. Actually, I heard that you are very busy, and though with our request, you accepted our invitation with your hectic schedule also. And thank you for your time, ma'am. And really, that whatever the presentations on COVID, and you shared your all the views, and despite your busy schedules. Thank you, ma'am. Thank you once again.
Thank you. It's always a pleasure to adjust my schedule for you. Thank you so much. Yeah.
Thank you, ma'am. Thank you very much. Thank you for accommodating us.
Thank you, ma'am. Next, we'll go for the next as per the schedule. It is a panel discussion by Dr. Amit K. Tiwari, sir, the Associate Professor, Department of Pharmacology and Experimental Therapeutics, the University of Toledo, United States. So we welcome you on behalf of IPA Annual Convention 2021, and we thank you for sparing your time with us. We welcome you, sir.
Thank you so much for this invitation. Let me see if I can.
Sir.
Welcome, welcome, Dr. Amit.
Thank you. I'm just trying to see if I can share my screen somehow.
Yes. Thank you.
It's not letting me do that for whatever reason.
If any difficulty, you can share your presentation, sir. Otherwise, we will share.
Yes, we might have to do that. Just give me one more second. Just trying to see if I have to change some settings here. Yeah, it's not letting me do that. Okay, so my file is huge. I mean, it's almost 200 megabits. So I can share it with Dr. Ramalingam. Maybe I have another computer
Yes,
here.
please share it to me and I'll forward to the organizer.
Okay. It's being shared, so I think it'll take some time to do that. Meanwhile, I'll keep on trying here if we can fix it. Are you able to see my screen by any chance?
Yes, yes, it's always visible. Please proceed.
Okay, great. So let me just make sure that
Yeah, it's visible. It's visible.
it's visible, right? Okay, good.
Yes, visible.
All right, let's see if it okay. All right. So thank you so much, Dr. Ramalingam, for inviting me, for this Indian and the workshop organized by Indian Pharmaceutical Association. Originally, as you know, this was supposed to be a panel discussion, but due to scheduling conflict, it was not possible. So two of my colleagues could not join. It's almost 12:36, going to be 1 a.m. soon here, and they could not attend this. But we decided to go ahead and discuss on the newer technologies to overcome multi-drug resistance that we are working on. And so this session would be more research sort of oriented. And I'll go ahead and talk about what is going on in this area and at least discuss one very interesting project that we think is extremely exciting to us. We wanted to share with you and take feedback on those. So again, thank you so much for having us here, and Dr. Reddy from Riper to invite us for this interesting convention. So without delay, I just want to share that I have a joint appointment in the Department of Cancer Biology in the College of Medicine and in the College of Pharmacy at University of Toledo. I'm also a director of international engagement at University of Toledo. So I have quite few diverse role, and we wanted to talk about that in the panel. But this session will be purely research oriented, as we discussed earlier. So let's see. Some of you who do not know where University of Toledo is, it's in almost northwest part of Ohio, bordering Michigan, right here. It's a large public university. It's a state university with over 20,000 students in more than 450 programs at UT. This is the aerial view of the main campus. I'm on the health science campus, where the College of Medicine and College of Pharmacy is. My office is in this green glass building on the second floor. So Dr. Ramalingam, we discussed earlier that you were going to visit. So hopefully, we will have some matches at that time to show you. We are very proud of our team Rockets at UT. So let's talk about drug resistance and why it leads to chemotherapy failure. And as you know, in cancer, after surgery, radiation chemotherapy is the mainstay, but oftentimes chemotherapy fails in majority of patients because of development of these drug resistance. And drug resistance, it is said that 90% in 90% of the cases where the tumor metastasizes to different parts of the body, it's because they stop responding to chemotherapies. Okay, and that's when they become drug resistant. So there are a number of factors for drug resistance that has been described in literature, majorly pharmacokinetic factors, lack of absorption, lack of distribution to the target site, um, faster metabolism, quicker elimination. These all could lead to drug resistance, or there is less drug intake inside the cell, there is less drug influx inside the cell. And even when the drug enters the cell, they get quickly deactivated or inactivated. The drug target site is altered. There could be a number of pharmacodynamic reasons that could lead to drug resistance. Similarly, there could be mutation at the target site, especially when we talk about cancer drugs. Cancer chemotherapy, as you know, majority of drugs act through apoptosis. They program the cells to die. And usually the mutation in that signaling pathway leads to drug resistance. So there has been a number of factors that has been described in literature, dysfunctional apoptosis, adaptive responses all could lead to drug resistance. One other factor that has been majorly described cause for drug resistance is drug efflux factor, which is overexpression of these transporters or the pumps on the cell surface that pump the drug outside the cell. That could lead to efflux of most of the drug, leading to less accumulation of drug inside the cell, not enough to kill the cancer cell. So these are a number of different factors of drug resistance, and I got introduced to drug resistance research when I came to US to start my master's and PhD. I was very interested in drugs. I'm excited about developing drugs now. But we found that although these drugs are very effective in majority of patients, they become ineffective due to number of different reasons, and that's where my interest is. Why chemotherapy fails in these patients. So it has been described that variable bioavailability, toxicity, development of side effects, unpredictable drug-drug interactions, or development of multi-drug resistance could lead to chemotherapy failure. And somehow ABC transporters, the transporters which are overexpressed on the plasma membrane, ATP binding cassette transporters, are linked to development of all these factors, that leads to chemotherapy failure. So those of you who are familiar with this, would appreciate the role of ATP binding cassette transporters in drug resistance and pharmacokinetics in drug-drug interaction. So it's one of the largest family of proteins with 49 members, 11 of which has been implicated in drug resistance. These ABCB1, ABCG2, and MRP family members are majorly implicated. These are present on the plasma membrane as can be seen here. So in general, they are, present to eliminate xenobiotics outside the cell. So they are actually doing a good job, right? They are actually expelling unwanted xenobiotics. But they consider cancer drugs the same thing. By the way, this was supposed to be a cartoon, animated cartoon, and unfortunately the slides are not being shared the way I would like them to be shared. And so I'm sharing them with some different function of Zoom, and that's why it's not as pretty as I would like them to be. But anyways, the point is that these transporters are overexpressed on these plasma membrane, and they eliminate these drug outside the cell. Mostly the anti-cancer drug, because they consider them as xenobiotic, and that leads to lower accumulation of drug inside the cell. And so one of the strategies that has been thought and has been explored widely is why not block the ATP binding site or the efflux function of these transporters and increase the accumulation of drug inside the cell. It's a very simple hypothesis, and I can tell you that past 3 decades, number of research groups have tried number of different strategies to block these efflux from these transporters, by small molecule, by natural products, by number of nanoparticle based therapeutics, shorthand RNAs, ribozymes, a number of other strategies. And we have done quite a bit of research in this area. But unfortunately, no FDA approved drug has been approved that is out there to block these transporters or overcome multi-drug resistance because of these transporters. So these are some of the papers that we publish. We publish more than 70 publications just in this area. But none of this led to any fruitful outcome. No FDA drug has been approved in the clinic for transporter reversal. There are a number of factors, and we know a number of those factors that resulted in clinical failure of a clinical trial phase for the transporters. So we have come far in the discovery of modulators of these ABC transporters. So we are in fourth generation of transporter inhibitors. But previous generation failed because of non-selectivity, because they altered the pharmacokinetic of the parent drugs that was being used to treat the cancer. They had their inherent toxicity, or they led to drug-drug interactions. So overall, this all resulted in failing of these projects. But we have other hypotheses, why these drugs or inhibitors would have failed. Most of the studies, tried to block one or two transporters at a given time point, and it is not very well understood how these transporters have overlapping functions or redundant function, and we know that they have redundant expression and function, and they have overlapping substrate profiles. So if you block just one transporter, it's quite possible that other transporter may take its function. Our understanding is very limited in that area. So part of my group is trying to understand the redundant function of these transporters in expelling the drugs. And so we are trying to also develop multi-targeted inhibitors that can block different transporters at different time point. So this is an ongoing project in ABC transporter area. But what we realize is that ABC transporter is not the only reason for drug resistance. There are other reasons, and we need to target factors that actually can perhaps overcome drug resistance in alternate ways. So presently, my lab at University of Toledo Cancer and Systems Therapeutics. So this is my group. You are only seeing a part of group here, which is working on drug resistance. So we work on drug development and drug discovery, and also to overcome drug resistance. So ABC transporter is one of the areas, but we are also involved in pharmacokinetic and pharmacodynamic based drug discovery and drug delivery, and understanding drug-drug interactions by synthetic and natural products. So that is some of the areas that we are trying to work in. Much recently, the lab has been focused in developing molecules that can overcome drug resistance by bypassing the apoptosis. So we are trying to develop non-apoptotic cell death inducers. So and I'll just talk about one project today, which is metaphagy induction, the last one. We have so much time to discuss this, but I just want to give you a glimpse of what is going on in drug resistance area, and different labs trying to tackle this problem with different approaches. And this is one of the approaches that we think is very effective. So just we'll just quickly scan through. I'm not going to go in too much detail in the molecular biology data, but just try to understand how we began this journey and where we are at this time. and how can we move forward from here, right? So I'll perhaps orient you in this direction. I think most of you already know about cell death. You know that there are two major reasons why by how cells die. They die through a programmed cell death mechanism known as apoptosis, where normal cells, when they're going through apoptosis, the cells shrink, the chromatin condensation is seen, membrane blebbing is seen. That leads to formation of apoptotic bodies, and these apoptotic bodies are then phagocytosed, leading to death by suicide mechanism, right? Other mechanism that we know is when the cell is injured or infected, it leads to osmotic pressure buildup, which causes cell swelling, and then the cell becomes leaky and it releases all the cellular contents, and usually it causes inflammation. This process is known as necrosis, right? So we know about apoptosis and necrosis. What we also know is that majority of chemotherapy that is out there, especially conventional chemotherapy, and even a newer small molecule targeted molecule that has been discovered or approved in last decade, they act by inducing apoptosis, right? So, our group has published substantially in that area of compounds that act through apoptosis, but we are also very interested to develop a drug that can induce cell death by non-apoptotic mechanism. So I'll just share a story of how we discovered a unique class of compound. So this was a serendipity discovery. We were actually working on dual tyrosine kinase inhibitors, and my student actually accidentally found that one of these molecule at higher concentration, as soon as she gave it to the cancer cells and colon cancer cell, this is one of the image that you can see. It started inducing a lot of vacuoles inside the cell, and they were filled with bubbles. This is very uncommon to see inside the cell, right? It did not appear to be apoptosis because in autophagy is cell eating, because you cannot really see those right away from the naked eyes. It was some other mechanism that was going on. So when she showed me this picture, my first impression was that cells are severely stressed out, right? And maybe because of lack of nutrition, they were actually, I think we have to mute somebody. I'm not sure who. Okay. So these cells were, swelling, and they were forming these vacuoles inside the cell as if somebody has done a gunshot, it looks like a gunshot, or Swiss cheese, as my friend describes. We did not know what was going on. So we started looking in the literature. So actually what she saw was that these vacuoles were forming, they were actually fusing. These, vacuoles were becoming bigger and bigger and bigger, then they detach from the surface, and then they burst, right? So this was very unique sort of phenomenon that was being observed, and we did not know what was going on. So we started looking in the literature, and what we found is that Dr. Maltese, who was a chair in cancer biology at that time, now is retired, they described a unique cell death mechanism a few years ago, and they named it methuosis. Methuosis means that you drink so much. It originates from Greek word methuo, which means that you drink so much and you are not able to pass anything out, and that keeps on building up to an extent that you burst open, right? That's called methuosis. So that's exactly what they were seeing by a different molecule called MOMEP, which was, of course, different from what we found with our PAPT compounds. But they found that these resulted in macropinosome cell drinking extracellular matrix, and these vacuoles, then fusing and becoming bigger and bigger. Ideally, they should go and bind to the lysosomes, but they were not binding to the lysosomes, so they become bigger and bigger and bigger, and they burst, right? So this perturbations of macropinocytosis associated with cell death, they named it methoosis. So our initial thought was that we may have found a different structural compounds that is really leading to methoosis. And then we started refining those, and we have optimized those compounds to make it even more effective, and we found even more effective analog that was producing more substantial methoosis like phenomenon. So we further expanded that, and then we characterize its cytotoxic behavior. So this is a colony formation assay. As you can see, the cells were being wiped out as the concentration was increased with these BAPT inducers in colon cancer cells. And this slide shows you the phenomenon. So if you look in the A, if you give BAPT compound to the colon cancer cells, very soon it was filled with vacuoles, and these vacuoles become bigger and bigger and bigger, and then they fuse together, and then later they burst. So figure B shows you the electron micrograph images how these vacuoles were fusing and becoming bigger. And in the last panel, you can see how the cells were bursting and they were releasing the content outside. So it was a very unique mechanism, but we were under impression that it is methoosis. So we further characterized methoosis by looking at number of molecular markers of methoosis or dysregulated macropinocytosis. So we looked at RAB7, LAMP1, and how they were increased, with increasing concentration. So we did all of these molecular assays to really confirm, and we know that it was doing methoosis for sure. One of the image that changed our mindset, where obviously it was doing methoosis, but also we saw that these lysosomes inside these cells were swelling, and they were very unusual. In fact, if you look at this lysosome, they appear to be 10 to 16-fold more swelled compared to normal cancer cells, right? So these are treated with BAPT compound and it's highly swelled. And we also felt that there are a lot of autophagosome that was being accumulated. So our thought was, wait a minute, maybe it is also making the cells not only drink themselves, but perhaps also eat themselves, a process called autophagy. So autophagy, as you know, is a self-eating phenomenon where when you stress the cells, or when there are some organelles that is damaged, they start forming these double layer coat. They're engulfed in that. They form autophagosomes. Autophagosomes then go and bind to the lysosomes. Lysosomes, as you know, is a digestive organelle in our cells. It digests whatever content, good or bad, in the autophagosomes, and these autophagolysosomes then releases the content, metabolic contents or redox material or biomasses, or the energy to back to the cells, which allows them to regenerate themselves, right? So it's a cell survival mechanism in a way, So if you stress the cells too much, they will start eating themselves so that they can produce more energy to protect the cells or let the cell survive somehow. But in our case, what we were seeing is with BAPT compounds, when we were doing this, they're actually dying. So how come the cell is eating or inducing autophagy, but leading to cell death? So we were very curious to find out, but first we really wanted to know it is actually autophagy. And so we looked into autophagy markers, and LC3B2 is one of the markers for autophagy that was highly upregulated with increasing concentration. We looked at number of downstream signaling pathways. mTOR is a negative feedback of autophagy. We looked at it and it was, of course, inhibited. We looked at other markers, and clearly autophagy was being induced. And so we thought, okay, let's give autophagy inducer, right? So if we induce more autophagy with the BAPT compound, it should kill the cells more. So we gave rapamycin so rapamycin, which is autophagy inducer, it inhibited survival. Clearly, it made cells die more, right? So which suggests that it was actually doing autophagy. Whereas autophagy inhibitor rescued the cell death, which suggests that autophagy was necessary for cell death. So we confirmed this with other markers, and we have done number of different autophagy modulators, baphlomycin, chloroquine, and all suggest that autophagy was necessary for cell death so far. So this actually led us to a conclusion that as soon as you give these BAP compounds to the cancer cells, especially colorectal cancer cells, it leads to accumulation of these vacuoles, and these vacuoles become larger and larger and larger. They do not fuse with the lysosomes, and that leads to cell death. In addition, not only the cell is drinking themselves to death, it is also eating themselves to death, right? So there's a lot of autophagy formation, but instead of making the cell grow or survive, it is leading to increased lysosomal activity. Too much autophagy is happening, which is further leading to cell death. So this was our initial discovery, but we further went on to characterize this new cell death mechanism, or at least hybrid form of cell death that we found, both methanosis and autophagy. And first thought was, is it apoptosis or non-apoptotic cell death, right? Most of the anti-cancer drug kill the cancer cells through apoptosis. So we, just to remind you, in apoptosis, cells shrink, chromatin condenses, and these are very classic way of cells dying. But in case of BAP compounds, when we gave it to colorectal cancer cells, we did not see any chromatin condensation. The cells were actually swelling instead of shrinking. The nucleus was happy and healthy, but cells were dying, right? So there was no apoptosis. So we looked at apoptosis marker. We did not see any cleavage of caspases, caspase 3 or caspase 7, or much changes in BAX-BAC, which is pro-apoptotic markers. We did not see any changes in the marker. And when we use pan-caspase inhibitor ZVAD, it did not rescue the cell death, which suggests that this compound were doing a non-apoptotic cell death, right? So because of some comment, I'm not able to move my slide now. Okay. So we also wanted to characterize different other cell death mechanisms. So we looked at non-necroptotic cell death, whether it is doing necroptosis or not. And we used classical modulator inhibitor of necroptosis, necrostatin, which did not rescue the cell death, which suggests that this is a non-necroptosis mechanism. We did not see much changes in the endoplasmic reticulum or mitochondria, and we have done a number of biochemical assays to also look into that. But it seems that mitochondria is being affected at higher concentration, so we are trying to look more closely into that. We did not see much changes in the generation of reactive oxygen species. As you know, many anti-cancer drugs actually induce reactive oxygen species to kill the cancer cells through apoptosis. But here we did not see much changes in reactive oxygen species. There was not much changes in beta tubulin activity. So clearly it is not killing the cells through to tubulin, so it was not a tubulin inhibitor. We looked into other colorectal cancer cells where there is RAS and P53 mutations. And what we found is that methanosis was happening in both KRAS or P53 mutant cells, which suggests that methanosis is independent of RAS or P53 status. So this made us think that, okay, now we found a molecule that is making the cells drink and eat themselves and killing the cells through a non-apoptotic cell death mechanism, which is a good news, because in colon cancer, which is the second leading cause of death, if you look at all the chemotherapy, the chemotherapy that is used currently to treat colorectal cancer all induces apoptosis. And now we have a drug that can induce non-apoptotic cell death. So our initial thought was, can we use it as an adjuvant? So first, what we did was we mutated, we knocked out actually BAX-BAC and double knockout BAX and BAC to see if they were relevant for apoptosis, and they were relevant for apoptosis. 5-fluorouracil that kills through apoptosis, and you can see that there is a white change as you knock out BAX and BAC. More drug is needed to kill the cells. Whereas in the right panel, when you give BAP compound, there's, they all die at the same rate, which suggests that back or double knockout has no significant role, which is clearly follows our initial finding that this is a non-apoptotic cell death. But what interesting finding we found was that when you combine this with other anti-cancer drugs, it was having synergistic activity. So you can look, when we combine this with oxaliplatin or 5-fluorouracil, we found synergistic to strong synergistic activity with these compounds. And this is very interesting finding, and we are trying to look more into it, which suggests that these compounds can be also used as adjuvants in colorectal cancer therapies, right? One of the questions that you may ask that, okay, these compounds are unique, they are killing the cancer cells with a unique mechanism of non-apoptotic caspase independent cell death. They're making the cells drink and eat themselves. Are they safe? So that is the first question that we also ask when we are into drug discovery projects, that are they safe? So we looked into normal cells and normal colon cells. CRL1459 is normal colon cells, and then we looked at normal fibroblast. We did not see much vacuole formation in normal colon cells, and they did not lead to cell death as effectively as the BAP compounds in colon cancer cells. We looked into zebrafish, we looked into mouse studies to look at the toxicity, and we did not see much toxicity with these compounds at the tested concentration, and we really went high concentration. And we further did more toxicity study looking at organ toxicity and blood chemistry, and we did not see much changes there. So clearly it is safe compound so far. We are doing in vivo efficacy studies with these compounds and patient-derived xenograft model in colorectal cancer. Now the other question that we had is, this is all good, we see a phenomenon, but what is the target? What is the actual target of these compounds that is leading to cell death? So we did the RNA-seq, and as you know, with RNA-seq, you get a lot of hits, but not always you get a clear answer. It directs you in some direction. So our initial guess was that it looks like a metabolic inhibitors, the way they are killing the cancer cells. And clearly metabolic pathways were very much disturbed in RNA-seq experiment. We did further kinome array to find out what is the target. With MOMIP that Dr. Malti's group discovered, it appears that it is a PIK5 inhibitors. So our BAP compound seem to be a multi-targeted agent, which affected PIK5 and also JNK pathway. And we have substantial data now to show that it is actually inhibiting those pathways. But we have more selective BAP compound that inhibits specific pathways. So I don't know if this slide is going to play or no. I doubt. It was a very nice video that I would love to share with you guys, but the way I'm sharing the slides, none of the animations or video will play. Anyways, what I wanted to show you here is this is a single vacuole, and this is electron microscope tomography, where you could see how when you treat with BAP compound, there is accumulation of these autophagosomes inside single lysosomes. So basically, what is happening is two things is happening, right? When you give these BAP compound to the colon cells, they are making the cells drink itself. So there's a lot of macropinocytosis. Fluid is building up inside the cells in the form of vacuoles, which is coalescing and bursting, leading to cell death. But also autophagy is happening. But these autophagosomes are actually coming to the lysosomes. As you can see in B, this blue line is nothing but the lysosomes, and this green is the acidic enzymes. And these yellow pockets are nothing but autophagosomes, right? It's a lot of autophagosomes, but it appears that lysosome is not releasing or clearing these autophagosomes or autophagolysosomes into its constituents, right? No energy is being released. So it appears that these compounds are actually blocking the lysosomes, and it is blocking lysosomal clearance pathway. And that also appear in our RNA-seq data and some of our preliminary data, that it appears that it is actually a lysosomal clearance blocking pathway. And our our initial understanding so far is it is inhibiting mTOR, PIK5, TFEB signaling pathway. So we are exploring that more. Because of time, I'm not going to dwell too much into that. But just to summarize these BAPT compounds, as soon as you give it to them, again, this was all supposed to be an animated slide, and it make more sense when you animate these phenomena. But BAPT compounds, as soon as you give, it forms vacuoles, and these vacuoles coalesce together, leading to cell death. And it also increases autophagy. Autophagosomes accumulate inside the lysosomes, but because of lysosomal trafficking defects, lysosomes keep on swelling, but does not lead to release of these energy from, digestion of our autophagosomes, which further leads to cell death, making them super weak. So this both macropinocytosis dysregulation, methoosis, and autophagy, or combination of both methooophagy, leads to cell death, right? So that is what we are trying to explore more now. This is one of the projects that we are working on. We have other projects that the lab is working on our other cell death mechanism, necroptosis. Perhaps we will talk about that some other time. But I just want to thank my team at the University of Toledo and the collaborators who have been working. We have been funded by number of funding agencies in US and international funding agencies. And we thank them all for supporting our studies. With that, thank you so much for attending my talk, and I'll be very pleased to take any questions.
Thank you. Thank you, Dr. It's a wonderful time, because though it's a midtime for you, late midnight for you, and thank you for
1 a.m. It's not a big deal. It's only 1 a.m.
Because so really it's wonderful that you have presented the recent things. Always that whatever the images you have shown is very interesting. The images and the real images were really interesting, and we can see some YouTube channels. Some students are commenting that it's very interesting.
I'm glad I was able to make this, and I apologize, the panel could not be here. We were hoping to talk a lot on different drug resistance modalities, but this is a very complex but very important area for all the pharmacy students, right? I mean, we all talk about drugs and drug and these effect, wonderful drugs fail to work in many patients in many different disease conditions, right? So that's been a major problem, and I think at least we need to be aware of it and see how to overcome those. So medication can be properly applied, and hopefully we can limit drug resistance as much as possible. So definitely in infectious diseases, but also cancer is a big thing. So yeah, no.
Yeah, and I think Dr. Reddy has joined. Sir wanted to talk to you. Sir, please.
Sir, sorry for you and troubling you to make it event. Hello, Amit sir.
Yes,
Sir,
yes.
So it's almost midnight now for you.
It's 1 o'clock here, 1 a.m., 1:15 a.m.
Oh, it's
Yeah.
very hard time for you. Very sorry for giving you trouble.
No, that's fine. I mean, I enjoy this. I mean, I was really not. We could not make it. The panel could not make it. That was the only upsetting thing.
Sir.
I hope that the session made sense to folks. It maybe just too research intensive,
Sir.
but I think this is an important area.
Okay. Sir, when are you planning to come to India? Is there any plan?
I was actually planning to come in June, but with the situation, we had to scale back. So if things look good, then I will try to come back in October, November.
So whenever you come, please intimate us so that we'll plan one
Absolutely.
program. offline mode. Offline mode.
Always, you know, I always think about you, and certainly we will update you. I'll keep you posted on that.
Sure, sir. Thank you.
Thank you so much again for the invitation. And
Actually, I had a meeting with the Vice Chancellor, sir. That's why I had been there, and I could sail back lately.
all right.
No.
Have a wonderful convention, and I will log in if I can a little bit later.
Thank you.
Thank you so much, sir.
Thank you.
Good night. Good night.
Yeah, good night. Bye.
Thank you. Next question is,
Yeah, we will move ahead. Sir? Padmanabh Reddy,
Yes.
sir?
Sir.
You can move,
Yes,
madam.
go ahead.
You can go ahead. Mujibuddin has joined?
Yeah, he had joined.
Yeah,
Okay, sorry.
join.
Sorry. Okay.
Yeah, we will move ahead with the schedule. Now we have Mr. Muzibuddin, the founder and CEO of Clinosol Research Private Limited and IPA Placement Coordinator, to discuss about the placement conclave that has been inaugurated in the yesterday's session by Dr. Suresh sir and Dr. TV Narayana sir. I welcome Mr. Muzibuddin sir to take out the session.
Thank you. I think is my voice audible?
Yeah.
Yes, Mujibuddin. Welcome. Welcome and greetings from IP Anandapur local branch.
Thank you. So I'll be taking most difficult questions for the students and the faculties and all the rest of audience. That is how to get the jobs and where are the jobs, what is the changes there's COVID has given. So I'll be focusing on this point. So hopefully I don't have much slides, so we will be able to do it.
It's okay.
Can you stop sharing of screen so that I can start sharing, please?
Madam,
Yeah.
Sir is telling that he will be answering.
okay.
He will be answering the queries from the students, so that we need to go through the YouTube also, where they will be posting the queries.
Okay, sir.
So immediately those queries have to be listed, and it has to be brought to the notice of Mujib sir, so that he will be answering all these queries.
Okay, sir.
Yeah.
I will go through.
Let me share my screen. Yeah, so let me know once. Is my screen visible?
Yeah, visible, sir. Visible. You can go ahead.
Yeah, so my first slide, obviously, Riper Anantapur, thank you so much for conducting such a big event. And I would like to thank Indian Pharmaceutical Association. My name is Mujib, and I'm the founder and CEO for Clinosol, and I'm the member for IPA Placement Committee, and I'm a IPA Placement Coordinator. So now first one, what is a career? What do you mean by career? So if you can read the statement, the best way to achieve is to create it. So we cannot achieve a career. We have to create it in a certain way based on our interest, our passion, and this will make us a suitable career. So never ever compare the career is getting a good money or getting a good corporate life. So career is something where you can create your own path, where other people can walk along with you a path of it. And here I'll be focusing on most important thing. How can we redefine the career goals? Because if you see the topic which IPA convention has been done is reimagining or making sure that what pharmacy can do in next generation. So biggest problem everyone have came to know that what is COVID and how we have suffered with COVID and all those things, everyone know about it. So after COVID, what are the possible ways of getting jobs? Do we really have jobs, or can we create some new jobs? So what is the future opportunities? How should we modify ourselves to get this opportunities in our basket? So this is what I'm going to make my presentation. So the recent study report, I think before I go to this recent study report, we have done one survey with most of HRs of pharma company. So we went into the pharma companies and we asked, what is your ability to take the freshers? What exactly you are looking at? Do you look at qualification or communication or reasoning, or what exactly you are looking at? So how much recently you are taking job hirings? So we got wonderful result. So most of companies are hiring. Pharma companies are hiring. So that is true. And we are able to generate more jobs because everyone is speaking about drugs and vaccines now. So only one person who is responsible for rational use of a drug, research of a drug. And as of now, I think recent sessions, very good sessions which are being taken, how drug discovery can be done and where pharmacist is a main important role which is being played. So most of times, if I remember, I always ask how much research is being done on this and how much practically it is being approved to the market. So this is what was being done. And the good news is that all pharma companies and CROs and IT companies want to hire pharmacists because we are the people who knows about the pharmacy, who knows about the biostats, who knows about the IT also. So there are some other things which we have to focus where we can improve ourselves and we can reshape ourselves or reimagine ourselves, and then we can go for next generation of jobs. So I'll be focusing on that. So now the job market. So most of people have spoke that we have increased amount of unemployment rate. But a good news is that we were able to place more than 200 plus people only in 6 months. So the amount of pharmacists got jobs only in previous 6 months. I'm giving the data of stats of 6 months. From January to June, we have given more than jobs of 200 jobs, that to the futuristic jobs, And you can say any number of jobs, we have lot of jobs. And the pharma companies and CROs and IT companies are reshaping themselves, revamping themselves, how we can work remotely, how we can work by sitting at homes without disturbing our day in and day out of life. And hiring space have been increased. So there is no question about it. Hiring space have been increased specifically for pharma people. So that's a big good news we have. So maybe the other people we really don't know, but pharmacist has to be there in order to make sure that the right and safe medications or vaccines or cosmetic products are reaching to market. And the whole research is on the shoulders of the pharmacist. Maybe it is a drug discovery or clinical research or preclinical research or marketing research or surveillance. So all those areas, we are going to have more and more openings. So enough, who lost the jobs? So many people said that they lost the jobs. There are multiple reasons people have lost jobs because people who are working in luxury or people who are working in traveling and all those areas, we have seen so much of unemployment. But surprisingly, the unemployment rate for pharmacy is very much low because we don't really find a pharmacist who is not having a job. So unless and until he is not capable enough of clearing interviews, we don't find a pharmacist not getting a job. And recently, the whole world is looking at India because the first vaccine, the indigenous vaccine from Bharat Biotech we got. And we have been asked from so many data and so many clinical trials and so many preclinical research. And we are doing more testings on Sputnik V. We are doing more testings on the Cardila vaccine. And we need more resources actually to make sure that the right vaccines or cosmetics or devices are being going into market. So the rise have been there. The job market rise has been there. And obviously, you will be having a very good future when you see after COVID. So where COVID has given a lot of job problems, we have got so much of jobs. The healthcare. So this is what has been done. So I'm focusing more about the research works. I'm focusing more about the futuristic jobs. when we see that, I think yesterday we were discussing about this topic, when we see that we need 20 years or 10 years to bring a vaccine into market, surprisingly within 1 year we brought the vaccine without adulterating or without compromising with data safety or the safety of the vaccine. So how was this possible? Because the adaptability of Indian people, the adaptability of the young generation. So young generation started thinking out of box, and they started bringing a lot of apps or applications and all those things, making sure that remote clinical trials can be done. And remotely we can collect the data, we can use the variables, we can use the ePros, and we can bring the real-time data, and we can get the submissions, and we can get the approvals for the market. So healthcare industry has grown up so much, and education e-learning sector, as we are sitting remotely at homes, I know that there are some challenges that when we go for e-learnings and when we think about e-learnings, there will be a high chances of students getting distracted from other things. But obviously, if you are getting distracted, it's your career and you are going to lose it. So you have to keep on encouraging yourself, attending this kind of conventions and futuristic aspects so that you can grow in your life. So we have seen a positive impact from the lockdown. So surprisingly, lockdown has increased the number of jobs, and new kind of environment, new kind of job opportunities have opened now currently. So that is what is the most important slide I have. Let me take you through the next slide. Yeah. So the challenge, what we are thinking is, the true challenge is not handling the remote working. So actually the remote working is not the true challenge, but reskilling of us is a true challenge. So how can we reskill ourselves? How can we meet up to the standards of the industry to get industry jobs? So we have to accept one or the other way. There is some gap between the industry and academics. Always academics is trying to fill that gap, and still the industry is moving in a very faster way. And academics is trying to catch hold of the industry, and collaborations with industry is always a good prospective area. So now companies have started thinking about reskilling of employees, upskilling of employees. So either whatever you think about your careers, it should be in two words. One is reskilling. So continuously you have to modify yourself, getting up to date of the latest trends and latest technologies, what can be used and how can we change this discovery models or production models or marketing models. So this is one of the most important thing which we have seen. And upskilling industries are spending huge money for upskilling of the newcomers. So if you see here, most of companies approaches me and say that, okay, we want to upskill our students or we want to upskill our employees. Can you give retraining for us? Because they are still using a paper-based studies where the data is being collected in the paper, and they wanted to go into electronic systems. So when they come to electronic systems, the next level of development is on artificial intelligence and machine learning. So now when we have thought of electronic data capture, we have a newer technology, which is artificial intelligence, which we should be ready to upskill ourselves. So if we don't upskill ourselves, then it will be a challenging aspect. Now, if you see the marketing representative who used to go and speak to a doctor and ask that, okay, this is my drug and all those things. So now the marketing representatives upskilling is also being done by using the digital marketing of pharma digital marketing, where branding of the drug products or molecules can be done remotely by using a posters or a videos or animations, whatever best possible way, without traveling from a place to place. So COVID has taught us so many things, that how I can reskill ourselves and upskill ourselves. So these are the two things the workforce or the freshers have to think. So companies have adapted to a very latest technologies, and we should be ready for the latest technologies to take it up and quickly pull it up the things. So this is about reskilling and upskilling. So as of now, I have put the three tips for the freshers. So tip one, rising competition is there. Obviously, if you are not in competition, you will not be getting a job or you will not be getting a good career in a job market. One should equip themselves with not satisfying with their own degrees. So apart from degree, what excess things, what you can justify in interviews, but there also need to be acquiring some skills like hands-on experience on tools, or industry uses, what applications or tools or what aspects industry is using, you need to upskill yourself. And presentation skill, this is one of the most important thing which you have to think about it. So now if you go for any other countries, there may not be a formal interview like person to person. There will be a group of people who will be sitting in a cabin, and they will be asking you to prepare slides of yourself. So your slides will be there, wherein you will be putting your positives and negatives, and you will be going and speaking, putting a presentation and saying that, okay, my skills are this. My skills are really suiting to your profile, and these are my positives, these are my negatives. So now you let us know what is your concerns or comments. So now this is the way the interviews are being handled, and the presentation skills is one of the most important thing. And writing skills, nevertheless, writing skills is the most important. Keep writing blogs, keep submitting articles, and improving the computer literacy, not exactly working on a Word document or Excel document, going beyond of Word and Excel, learning macros and learning the formulas, using the data-centric models, wherein this will be added advantage for any of the student or experienced persons to go into the company. So this is the tip 1. So have focus on industry experts, or go and talk to industry experts who are really working, have some time to spend with them and learn hands-on on the applications or tools which are being used. So now the tip 2. So don't wait for your exams to be completed. Don't wait for your final year of B Pharm and PharmD to be completed. Start thinking about your career from the day of 3rd year or 2nd year. You have to plan accordingly about your career. So planning your career ahead, attending the live industry webinars. So now this webinars, one or the other way, if something around 1,000 students are attending the sessions, at least 20 students are getting these points and implementing in their lives, my session is very much useful. So now please try to attend live webinars, understand the importance of webinars, and focus on the webinars. Understanding the updates and technology challenges. Now, probably when there is a technology word, there are challenges also. So it's not so much easy that I'll say that, okay, patient does not need to come to a doctor. Patient will sit there only, and he will be able to give the signs and symptoms. I'll be able to give treatment. So it looks very simple, but there are so many complications in this, because patient may tell lies also to you, or patient may tell half information to you, and doctor will be unable to understand this. So now, say for example, if I introduce a technology where it is a wearable for the patient, and immediately if something happens to patient, a message is triggered to a doctor, wherein based on the message, he can be able to give the treatment. So now this technology advancement is being used now currently to conduct most of research, and most of telemedicine is being used. One of trends which are driving in industry as of now, probably one of the most important question, today we have got COVID, tomorrow we may get one more thing, but how much quickly we can get the treatment to the market, safe and effective treatment to the market, we have to understand. And we should find out where you can find out the opportunity. Don't sit at home and say that, okay, I don't get job, or else my college or my university or my relative will give a job. So it's not their work, it's your work. You have to think about this lines that it's your career, you have to plan accordingly. So you have to go into market, everything is there in your hand, which is in your mobile. Use technologies to understand where are the openings you are having, what are opportunities you are having. One more important tip you have to understand, don't have only one resume for all jobs. Now, for example, a job is being posted saying that, okay, you have to work on analysis, for example. So now focus on your resume, more technical points, putting it in analysis. And if the job is for clinical research, for example, I'm telling, so focus on your resume to put more points of clinical research and putting the certification. So one resume will not be same for everyone. So the future is on a different kind of strategies. Now people started speaking about infographic resumes. Now, why should we write stories and stories on resumes? So it's not needed. So do you think that HR will have a time to read all the stories of the resumes? Answer is may not be. So how can you come up with a resume which stays outside of the remaining public? So you put it as a infographic graphics and the pie charts, presentations, all those things you include into your resume, saying that these are the efforts which I have made in my colleges and academics, and these are the new things which I have access to the other people. So this makes your resume as differently. So now going forward on infographic resumes, if you think about infographic resumes, the latest, the next level of resumes have came up, which is video CV. So what is the need of a document to have a CV? So can't we record a video saying that, okay, my qualifications is this, my positives is this, my negatives is this, I know this X, Y, Z. Can we create a video and post it in LinkedIn or send it to HR? So when HR is having time, he can see your initial screening of knowing your communication skills, knowing your how confident you are in interview, and what is your positive skills. And where Word document or infographic does not speak about your communication skills. Though you say that I am having a highest communication skill, I can work for 24/7. Unless and until you speak, your HR will not know. So first level of screening, HR does not need to call you. HR does not need to take an interview for you. He can understand, okay, he is really capable enough of handling the situations in my interview, and he can clear the first round and he will directly go for a technical round. So now think about video CVs. This is one of the big area. So in collaboration with IPA, we have conducted a video CV competition also, and we have given prizes for top 3 people of video CV competitions also last month. So this is tip number 2. And tip number 3. So this is most important tip. If you get a job, we think that, okay, learning is stopped. I will go and do a party. I'll go for this. I will go for that. So, but remember one thing, always you have to have a thirst of learning. If you get a job today also, you don't really know that this job will be there after 10 years or not. So do you really find any tailors in cities? Most of the people will say that, okay, sir, only 10% of tailors are there. So now why tailors have been reduced drastically? Because the reason was we were started going for purchasing the ready-made clothings, big shopping malls we used to go, and we used to start purchasing it. Now, if you see 10, 20 years back, if you find out any place, we used to buy a raw material of a cloth, go and give to tailors. So now if you don't think in upskilling and reskilling and with the learning, every time I suggest freshers or people who are in academics, I suggest that your learning should never stop. Learning, keep on learning. So what is happening in India and in industry, you need to start thinking and you need to start learning. Never stop learning new things. Expose yourself to a practical learning than classical training models. Now, classical training, if you start thinking that I'll sit in my class only, my professor will come and wear a good dress and he will put it in board, then obviously answer is no now. So now everyone is at remote and we are still living, we are still working, we are still learning. So now don't expect that, okay, COVID will go for 1 day or 2 days. Now, when we thought, when first initial lockdown was being put last year in 2020, people started thinking that, okay, after 20 days, COVID will go and we will go for normal classes, regular classes, offline classes. But never ever thought that COVID will be exhausting or long lasting for this many days or this many years. The answer is no. So if we would have thought about that on day 1, we would have changed our careers till now. So this is what, see guys, you can earn money, but you can't earn time. So you need to focus on your time, that how best you can use your time for learning prospective area. And basically practical learning is important rather than by hearting things. So that is what as industry is expecting, that they don't expect a definition or a by-hearted things. They are expecting that how practically you can solve a problem. So there is a problem, how practically you can solve a problem. So this is what is industry looking. So don't wait for your dream job, create your dream job. So that is what is my intention to tell this tip 3. So let me go for this. This slide makes that you break your all myths, think out of box, get your jobs. So don't ever think that, okay, my senior has gone into this job, I'll also go into this job only, because there are future opportunities, future objectives. How many of us have thought that health economics will play a major role for us? So most of us will not say, okay, sir, what is economics and what is health? So what is the link between these two? So, but this is playing a major role now. There are so many jobs now for health economics. And now outcome research, how many people have we thought that, okay, the quality of life of the patient is important for a drug. So we never have thought about it. So because the quality of life or the happiness index of the patient is so much important when you are giving a drug. We are not totally giving a treatment. We are only we are also checking the index of the happiness, that how much the patient is feeling happy. So if your drug is not making a patient happy, what is the need of taking a drug? So you are making the patient to feel good after taking your drug. So now there are so many new industries like health economics, the vaccine cost. Now, for example, vaccine cost is around 1100. So do you think that all people can buy this vaccine? Answer is maybe or may not. So how can best we reduce the price of the vaccine, making sure that all the individuals, irrespective of caste and religion and richness or poorness, everyone is getting treatment. So this is the industry which we are going to get. And now there are public health sectors who are hiring pharmacists for the research-oriented data-centric models, where we can know that the reason why exactly this is happening, why this trend is happening. So you would have seen so many research papers or so many assumptions saying that, okay, third wave will come in January or August or September. How are they going to get this information? So these are all are called as data-centric jobs. And you can break your myths, go into this latest trending jobs, apart from your regular job. So this is what is your future, think out of box. So now the latest jobs, I think yesterday also there was a discussion about the latest jobs. I'm just putting some jobs here, the new hot jobs where you can work from home, where you can work remotely. So as I said, we were able to give 200 plus jobs. 80% or 90% of jobs where our students are doing is work from home. So this all jobs are being done work from home. So they are staying at home and they are still earning very good handsome of the salaries. So clinical data scientist. So the data science, we normally thought that data science is only for the IT people. But when the word comes as a clinical, it becomes a clinical data scientist. And normally the IT people does not have a clinical knowledge or pharmacokinetics or pharmacodynamics or pharmacology or your physical or chemical aspects of the drug molecules. So now when there is a drug and patient comes into a picture, and when the data comes into a picture, it becomes a clinical data scientist. This is a hot job you have, and people are looking for it. The next generation will be clinical data scientists. So based on the seeing the data, we can know that how much drug can be surviving in the market, how much drug can be going into the market. And remote monitoring, obviously, guys, one of the best jobs you have, remote monitoring, central monitoring, remote trial monitoring. When you are conducting any research on the patients or human beings, remotely, how can I assess that whether patient is taking the drug properly or not? I think if I am not wrong, yesterday Suresh sir was speaking about a drug which is being taken by a patient will give a message to a doctor that, okay, patient has been taken patient has taken the drug, and the message goes to a doctor. And this is one of the best way to understand the compliance of the drug. You don't need to go and ask the patient saying that, have you taken a drug or not? Because you are automatically getting the data from the drug, where in the drug you will have a chip. And that will give a message to a doctor that, okay, patient has taken a drug. So in other words, there are some magical boxes also. Yesterday, Suresh sir has explained magical tablet. So magical boxes are also there, where you have a bottle of tablets. Now, if you open that bottle one time and take a drug one time, then it will give number 1. So now the bottle makes sure that it is counting that how many times you are opening the bottle, how many times you are taking the drug. So now these are the smart ways what the drug discovery or the research is flowing, and the pharmacist and pharmacologist can go into this way. So remote monitoring is one of the best job, hot job, where you can work on it. And clinical data analyst, validation of data. So as of now, biggest problem is the validation of data. The data is very much important, but how much trustfully, truthfully the data is. Now you can ask me, sir, you have said that you have got 200 jobs. Is this a valid data? Is this data validated? Then I can show that, okay, all 200 offer letters, all 200 student names and mail IDs and phone numbers, I can give it to you. So it means that the data which I have is validated now. So now when you have the research conducted for any molecules or any vaccines or any cosmetic products, the data which has been generated from the patients, it has to be validated. That means that it is clinical data analyst. And there is clinical data managers and pharmacovigilance associates. Now the bells started ringing. Now Indian government also have started taking necessary actions on the pharmacovigilance, and pharmacists have to play a major role in pharmacovigilance. Pharmacists have to play because it's the HCPs who are making sure that the right medication, the rational use of medications and prevention of adverse events is being taken care. The government of India, PVPA, has taken a necessary step to start AMCs at different colleges who are associated with the hospitals. And PVPA has started approaching all companies that all companies should have a wing of pharmacovigilance. So you believe it or not, every company in India who is manufacturing, who is selling, who is marketing any molecule should have a pharmacovigilance team. So you understand how many jobs we will be creating if we get this kind of things. Because no drug is safe unless and until it is being used as rational in a right kind of usage. So now pharmacovigilance associates are one of the most important demanding jobs. Either it is drug safety associate, medical information call centers, or signal management or risk management plans, or aggregate reporting. So I have not given more teams into this, but I have just put the main teams where you have the more newer jobs and clinical programmers. So we are using the applications and the tools or databases. Now you say, for example, before 2 years, anyone knows about Zoom? Answer is may not be no. So before 1.5 years, 2 years, anyone knows about Zoom? Answer is no. So, but Zoom is being so much adaptable by people that Zoom is being used by this many people. So now why can't we use a Zoom for taking a consent? Why can't we take a Zoom for counseling the patients? Why can't we use the Zoom for conducting clinical research or market research or surveys? So these are all things which you can do as a clinical programmer. This is one of the hot jobs you have. And obviously, I think Suresh sir also have spoken and TV Narayana sir also have spoken about clinical pharmacist jobs. So government has opened for clinical pharmacist jobs, and clinical trial associates or project managers or CRAs, whatever you say, these are one of the most important jobs. And the next hot jobs, imaging processing. So now you see an X-ray, you see an X-ray and you say that, okay, this X-ray is, this patient is having this X disease or Y disease. But now the things have been changed. The X-rays or ECGs or scans or all these images have to be converted into data. Because I need to understand that how my drug is giving effect on your X-ray or ECG or scans. So I have 10 visits and 10 visits, the patient have taken the X-rays and ECGs and scans, and I don't know how the drug is behaving on the X-rays. By saving an X-ray, I cannot know what is happening. So, but the process have been developed such as we can convert these images into data. So, and wherein you can develop this and understand how the drug is showing efficacy and safety on the drug. And medical writers, obviously, nevertheless, we have so many new opportunities. Medical writers, I think recently our students have attended one interview and they have 4 rounds of interview, 3 rounds of technical and 1 round of HR. So you can understand how much critically they are looking at medical writing jobs. The people who have a very good sound writing skills and speaking skills can go and work in clinical medical writing field, and it is ever-growing field where you can work on protocol developments or CRFs or ICFs or PSURs or CSRs. And document specialist, so huge amount of documents. Now you cannot use a paper versions. As of now, as I said, huge number of documents are being collected, huge number of data is being collected. How can we arrange these all documents at one location by using a tool which is called as Trial Master File? We have a Viva Vault systems which is being in rise now, and if anyone is learning this, you are being hired like a hot chocolate. So Trial Master File Specialist, or document specialist in clinical research or drug discovery. So these are some of the most important jobs which will be your future. Either it is data analytics or artificial intelligence or machine learnings or data digitalization or digital marketing. These are all good words, guys, which you start thinking about these areas, do research and learn things, and then you are going to get suitable jobs. And definitely we are there to support with respect to placing the students, freshers and experienced people. So now, yeah, what is the skills to be job ready? So the first one, logical ability, writing skills must ensure, presentation skills must ensure, computer literacy, basics and advanced and technical skills. Apart from your regular academics, these are the things what you need to have to make sure your skills. So I have given some points here. Competencies, growth and knowledge and experience learning and advanced learning. So will lead to skill development or upskilling or reskilling. So this is one of the most important thing which you need to understand. Yeah. So now the most important slide for us. we have seen most new jobs now. Sir, how can we find this all jobs, and what how we can approach this job market, and how we can know what is the future of new jobs and how we are going to do it? So now we came up with a planning, we came up with a strategy where academia and as well as corporate together come together and give the openings to us, and we will be posting these openings in the website. So one website where companies can post their jobs, students can apply their jobs. So that website we have developed. I would be very thankful to TV Narayana sir and Shesh Sai who have supported and who have worked on this. So I'll be showing this website how it works, and you can always go here and search for the openings, and you can get the new jobs, and we are going to give preference. So all over India. So I'll just open this website wherein I can show you the website. So this is how the website looks. And in About Us, we have given about IPA and our presidential note. And we have given some of the job openings or some of the advertisements, what we can use at the bottom. And we have given our contact address, either it is mail IDs and phone numbers. So now we have given MOUs, as Narayana sir has rightly said that we have got good number of MOUs with companies for internships as well as jobs. So both are having the opportunities. We can give internships as well as the placements and jobs for the new kind of environment. So this field will give the details about MOUs, the list of companies who are tied up with us. And we have created the placement drive also, where we will be posting the walk-ins along with our collaborators. So recently we have held a couple of placement walk-in drives in some companies, and this tab will show you what are the walk-ins you have for the companies. And current job openings, you can look into this current job openings. In this tab, you will have the current job openings, the futuristic job openings, all things I'll be or we will be posting here. And you will have apply now, so wherein you can directly apply. So, but here we will be able to give only to the membership. So what we will be doing it is, we will ask a question, are you an IPA member? So now if I say that, yes, I'm an IPA member, then they will ask, what is a membership number? So now if I say that, okay, my number is this. So now then automatically rest of all details will be filled up. So saying that, okay, the name of you is this, and your mobile number is this, and your this is this. So now you can proceed directly to fill your resume. So you will have this all following details like educations and skills and preference for job and references and uploads of your photos, your passport size photo, Aadhaar card, PAN card, resume, and any other certificates. If you want to upload, you can upload it. Now, for example, I have just given that I am a B.Pharm passed out, and I said my passed out year is something 2020, and I have given some percentage as 60%. So now I can go and enter what are the skills I have, and I'm looking for a job. So now you can think about quality assurance job. You want quality assurance job, you can check this. Or you want the pharmacovigilance job, you can check this. Or you want clinical pharmacy, you can check this. And you want marketing or clinical data management jobs, you can check this. You can check clinical research jobs or handling of instruments jobs also. Now, for example, I'm clicking on production and I'm proceeding it, and they will ask the preference of jobs also. So now, where do you want to work? So do you want to work in production, or you want to work in R&D, or you want to work in any corporate companies? So then afterwards, you will be giving references. What is your references? One life member reference should be there, and their designations are their what is associate professor or all those things, and phone number you can select, and then you can give your uploads. So you can give uploads. I'm sorry, I need to select this number, so it should be fine. So now then you can complete your uploads by giving your photos and all those things. Say for example, you are not a member. Now for example, you say that, sir, I am not a member. So now if you say no, then it will direct you to here, click here to become an ordinary member. So now one time you have to become a member, wherein it directs you to payment gateway. And this will be your form where you can give that subscription members only ordinary form. So students will be able to select this, and will be very basic amount for taking the membership. And once they have submitted, they will get one ID, and from there you can go back and do it by yourself. So this is how you will be having applications filling, and once you have filled, we will be taking you through that. And now coming back to recruiters, the recruiters also can fill the form here, and it will directly come to me, and I'll be able to give any kind of openings to a colleges or companies. So academic institutions and companies can contact us, and they can give number of vacancies and last date for application, who is a contact person, contact name and email IDs, and any remarks. And they can directly write a mail to me also on this. And we will have recruiters form wherein they can complete this recruiters, and we have created a latest news also. So wherein you can understand the latest news, what is happening currently. So this is about the website. You can upload your resumes, you can upload your details to get the jobs, and we will be keep on posting the job openings in this tab. So based on these jobs, you can apply here, and we will be taking the resumes, and we will be scheduling your interviews along with companies. So this is how this website looks, and we have made so much of validation into it so that students feel easy, user feel easy. Even companies can give us openings, and we have given access. Even company can come and give the openings to us, and we can upload the openings here, and directly students can come and apply here. And this openings will be not for one country, it will be for India wide, and we are looking for, even if we can post any of the outside countries jobs also. So this is something which we are looking at, and this is something which we are working on it. So this is about it, and I'm going back to my slides. Yeah. So now this, I have given the portal details and how it works. I have just given the 3 steps. One is registering along with IPA, or if you have IPA registration student ID, you can directly go apply from the portal and get the interviews. So that's it. And here it is. The website is being given. So I'll be posting this website details also in the group. I'll be sending in YouTube also. So that you can take it up, and you can start applying for the new jobs. Very good. So now how Clinosol can help. So I think you guys know about Clinosol. I'm the founder and CEO for Clinosol, and we have an MOU with IPA also. So we most of the times we give trainings on this all latest trends and technologies like clinical research, data management, pharmacovigilance, and medical writing and regulatory affairs, and clinical SaaS. So if anyone have any questions about the technical trainings, what we provide and how can you get this technical trainings, you can always contact us on the below number. It's a toll-free number. It's a IVRS number. You can press number 1 to speak to training, number 2 to speak to consulting team, and number 3 to speak with technical team. So now one of the most important thing, we have seen the growth with respect to the number of jobs. We have got 200 jobs from January to June, and the collaborations with company, we have got 8 companies onboarded with Clinosol who provides the jobs for the students. And the webinars, we have conducted more than 40 webinars, and we have given more than 60 internships, and we have conducted nearly 40 expert sessions, meetings with CEOs, entrepreneurship programs for Clinosol. And this is the one of the most important slide which we share with the companies, and we share with the industry experts so that they can collaborate more, and we can get more kind of jobs and more kind of growth for the students. Now, these are the jobs which we have got in recent 6 months. So there are all kind of new latest trending jobs which students have got. So 55%, as I said, pharmacovigilance is a growing field and it will grow. So there is no doubt about it. So understand, after 10 years, most of companies would need pharmacovigilance and they would not be disturbed or having the fear to hire the people. And surprisingly, the highest package for the students in Clinosol, we have got 6 lakhs. 6 lakhs for a fresher. 6 lakhs for a fresher, and 5.4 lakhs for a fresher of PharmD who is 6th year currently pursuing. So he was currently pursuing in 6th year PharmD. So he was able to get a nearly 5.5 plus lakhs of salary. For a B Pharm, we have got nearly 4.8 lakhs of salary. As a fresher, I'm giving this data, the stats. So this is about the placements, and we have interactive learnings online and offline, both models. And the next one, this slide is most interesting slide. How can we learn hands-on on pharmacovigilance? We came up with a collaboration with PVH, one of the company. PVH have started thinking that they can give some trainings to students, and they came in collaboration with Clinosol. And there is a live webinar, which is free of cost, on Saturday, 24th July. You can contact the below details and you can attend this webinar, where you will see the systems or advancement of pharmacovigilance, how the cases are being tracked and processed, and how we are reporting to regulatory bodies. So now international conference, SCDM, and this is an international conference at once. You will have Europe, US and India people are attending this conference. This is most advanced conference, SCDM, Society of Clinical Data Management, from US and Europe. They came with collaboration with Clinosol as academic partner, and we are having this conference. To know more about it, please visit scdm2021.org. And these are the networks where you can follow up Clinosol, and you can get the openings wherever you want openings. You can follow up in LinkedIn as Clinosol Research, and Facebook, Instagram, and Twitter, and YouTube. So I think this is the last mail ID, last slide, which is very happiest slide. I don't think so I have taken much time. So I'm open for questions. So these are the contact details. I'm open for questions. Any questions anyone have? You can take it up from YouTube and post some questions to me. I'll be happy to answer the questions.
In YouTube, sir, Musibuddin, sir, I am audible.
Yeah.
There is one question, like due to COVID pandemic, the students are not able to perform their practicals, and will the industrial people will opt for them for the job?
See, basically, when you see the question here as practically and theoretically, what is this theoretical and practical means? If the students start working on it, it is a practical one. When the faculty is just telling this all stories, it will be a theoretical one. So I'll just show some examples here. So now when I have this question that how can I make the engagement with students? So now we started thinking that, okay, my classes should not be as a slide presentation. It should never be a slide presentation. It should never be giving us a slide where I just go and read it. Because some or the other way, my voice may not be good or my face may not be good, and students may not be interested to listen or look at me. So how can I engage my audience? So this is the most important thing, because they have only YouTube and they're looking at it. So now what we thought of doing it is, we started working on some of the most important things. So how practically you can grow, I'll just tell some of the things. Now, what we have done is we came up with some of the aspects where you have can I have everyone on mute?
Ramanikam, sir, mute yourself.
Okay. Now I'll try to show some of the aspects where you will be able to understand how best we can learn this practically. Now, for example, I have a question here where I'm asking that query metrics will be given in which information. So this is the question. Now, if I start telling this answer, practically you will not understand this. But first, what I make the students to do it one day before is I'm going to speak about query metrics on today. And now on that particular day, they will come and sit in the classes, and I will give a code to them. So I'll give a link to this. I'll give a code to them. and on their mobile, they can select the answers. So now, okay, number of open queries or number of queries, and they have voted in such a way that I'll get the responses here. So now, do you think that practical information is not possible in this way? Answer is no. So the probably the question here is we have not taken the right steps to understand how practically we should learn and how practically we should implement these aspects. So this is point number one. And point number two is I would always prefer taking not slides but using whiteboards. Now I'll show an example of it. So now I'm going and opening a whiteboard wherein how practically you can learn these things. How practically, what is being practical when you involve yourself, then it is a practical. When you are not involved in themselves, then it is not practical. So now I'll put a word saying that now I have put a word ICF. Now I'll start asking like, guys, can you tell what is ICF? Now they'll say, okay, sir, this is informed consent form. Can you tell what is the importance of this? Then I'll start saying that, okay, ICF is being classified into 3 types. This is X, this is Y, and this is Z. Now, when you practically learn these things here and go and do the assignments based on this. So I'll give assignment on this. And when practically you do the assignment on this, now where is the question of not learning practically? So now practically our students have submitted nearly 250 blogs. So there is no question of practical learning. Practical learning is there, just that we are not seeing this. So this is yesterday's class where we have taken this class that pharmacovigilance cases were being classified into X and Y, and X are this and Y are this. So remember guys, no one will come and tell you, okay, start learning practically. So now if you want to learn practically, you need to include polls in your life, include research by yourself, include learning by yourself, then there is no stop of learning. I think that makes some sense. And currently there are so many technologies. Practically you can learn things from at home. You don't need to travel to learn practically. So this is what is my answer. I hope I am clear about it, right?
Yeah. Nicely said, sir. We'll take the next question.
Yeah.
What do you think the most important for people to get a job, a master's degree or experience? A job, master's degree or experience?
This is a very quite interesting question, because if you see this question, I'm a native of Anantapur. I born and brought up in Anantapur. So when I was studying this pharmacy, surprisingly I came and ended up in pharmacy, because most of people may not know that I'm not a biology student, I'm a maths student. So I was an MPC student, and there was no BPC seat, so I went into MPC. So after that I wanted to do engineering, but I did pharmacy. Somehow I did pharmacy, diploma and then bachelor of pharmacy. Then later on I started thinking that should I go for a job or should I go for a master? There are 2 ways. Should I go for a job or should I go for a master's? Now started thinking that, I started working in a company. Then I came to know that always qualification will give advancement into careers. So there is no doubt about it. So experience is needed, but always your qualification will always push you into upwards. Then I started thinking about MPharm. Once the MPharm is done, I started thinking what else I can do. I did my master's in clinical research. So now masters in clinical research have given more chances for me. So now here the question is, it all depends on your life. What do you want to become? So, but don't stop your education, further education. So now if you want to go for a job also, you can go and get experience, but it doesn't mean that your qualification should not be increased. It should be obviously increased. Your experience along with your qualification should be there. So I think that makes some sense.
So we'll go to the next question, sir. Any digital marketing scope in pharmaceutical industry?
Answer is definitely yes. Definitely yes. So there is no doubt about it. Definitely yes. So now you are the people who can understand how the marketing, how consumer can be attracted. So forget about going and speaking and telling about your product and going and giving a pamphlets or putting a hoardings on the markets. Forget about this. So the future is on digital era. The digital era is how can you engage the consumers? How can you improve your followers? How can you bring a brand? So rather than saying a digital marketing word, you think about brand management about your products or about your services. See, everywhere we have brand management wherein we have a brand called as, like for example, now IPA. IPA is a brand. So now Riper is a brand. So now how can you improve these words into people's mindset? So once you see a logo of IPA, I will come to know saying that, okay, this is IPA. Once I see a Riper logo, I'll come and say that, okay, Riper is one of the best college and best research has been happening and best placement is being given. So now that engagement, that consumer collaborations, once a consumer start taking your services, he should take for lifelong. So that's what we also believe, that all our alumni students in Clinosol, so they are in touch with Clinosol and they give further openings for the next generation people. So engagement to your audience, guys, you need to understand, and digital marketing is having a huge boom, or you can say it as brand management. Either it is a product or service, your company brand should be created in such a way. Then only people will get attracted, and then only people will start using your services. Or else you sit at home and you're not going and telling anyone, then no one is coming and taking your services or products. So this is one of the most important thing.
Yes, sir. So, shall we move to the next question, sir?
Yes. I'm very happy that I'm getting a lot of questions.
Sir, is it mandatory
You have a lot more, sir.
I'm open. I have made my lunch as a biryani, so we don't have to worry. So I'll have more questions answered, and then I'll go and have biryani.
Yeah, you have a lot more questions. So many questions, because the placement is one of the theme for the student participants.
Basically, I can give the jobs, sir. I'm repeatedly telling that jobs are there. There is no doubt.
It's a kind of titration. No, it's a kind of titration. The end point is only placement. So everyone will be keenly looking at end point.
Yeah. I completely understand. Yeah.
Sir, shall I?
Yeah, please.
Yeah, is it mandatory to pursue a vigilance training program to avail that particular job?
Well, answer is may not be and maybe. So both ways I'll justify this answer. Because what has happened is industry started exploring more of opportunities when they are getting a trained resources, when they are getting hands-on experienced resources, rather than taking a fresher directly from a college. They may think that, okay, I will decrease my amount of time to give a training to a resource. I'll directly give types of cases to the resource and I'll ask them to start working on it. So the amount of time and the amount of efforts which company are putting at it, so they have reduced it. So why CCDM or SCDM or Covans or Sun Pharma or Jeevan Scientific, all these companies have came into collaboration with Clinosol is because we give ready-made employability candidates. So you have learned end-to-end of subject in your college. You have learned discipline. You have learned everything: pharmacology, cognosy, chemistry, everything. But the right usage of your job is very much less. And that kind of job training, when we are giving training, so we go and market to the company saying that, boss, you take our candidates and they are well capable of bringing new ideas to your company. So you don't need to go from a scratch saying that, okay, what is pharmacovigilance? What is the type of case? What is the triage? They can give a good ideas, new ideas, that how can you reduce the time and how can you improve the quality of the work. So when the candidates of Clinosol went for interview, the directors were really happy with the amount of knowledge they have brought and the amount of slides they have posted. Now, if you go back to LinkedIn pages of Clinosol, most of students who are studying in Clinosol have created wonderful slides and they have posted in the LinkedIn, tagging the companies itself, saying that, boss, you see the slides and you tell us that we will be able to explain the slides to your company. You give us opportunity, we will go and prove ourselves in the company. So this is the way you can upskill and reskill to a company and you can sell yourself. So remember, selling yourself is one of the most important thing you need to understand. So when company will buy you, when the company thinks that, okay, taking you will be additional expertise or additional advantage, because this is not a physical work. It's not a laborish work where I will say that, okay, a human being is there, I will put some 4 stones on him and he will travel. So it's a very technical job and it's a very advanced jobs. And there are so many new regulations day by day we are getting. And we should be capable of getting those things, and we should be able to get the projects. And if company wants to get a project, they have to have a wonderful resources who can sell themselves to get a project. Now, why company will hire you? Not to give salary. So company will hire you to show that to the other companies to get a project. If you are not capable enough to bring more projects, then what is the need of taking you? So it's not a 9 to 4 job or 9 to 5 job. So you have to understand that capability should be there, where company will pay you more money because company is getting more projects. So I hope that answered my question.
Yeah. Next question is, what is the role of QA and QC in pharma industry?
Yeah, QA and QC role, guys. One more time, it is taking a new diversion. QA and QC also is taking a new diversion. Earlier, QA and QC was being done on paper-based studies, or we are collecting the data on the paper. But the current good manufacturing practice, which was being released by CFR's US FDA, has given a very good validation rules for QA and QC. So up to my knowledge, you may not have heard about this all technologies and advancement. The future is good for QA and QC if you are well versed with validation and CFR regulations. So I'll repeat it. You need to understand the validation of tools and technologies, because even QA and QC is not being left. Even QA and QC have to be implemented with the technology where the product is validated. So you can sell the drug market in India saying that, okay, sir, I want to only sell in India. It is fine. But if you are going for US market or Europe market or Australia market, they may ask you for a documentation about GMPs and for the QAs and QCs. And when you are been sending the documents as a paper format, they may not accept it. They want their data to be submitted in a soft format or electronic format. And how best you can validate your product, how best you can show your quality of the product, how best you can do your packing and labeling of a product. So this is, I think, one more time, the digital marketing word comes here for packing. So I'll tell you one of the latest jobs which we got now. So they asked us that they wanted people for graphical designers with a pharmacy knowledge and with a pharmacology knowledge and zootics knowledge. So what was that was they had a product, they had a tablet, and they wanted to pack in such a nice way that people, when they see the consumer, see the product tablet, he has to think that, okay, it is having some good thing. It gives a assumption, or it gives an intensity thirst to take a tablet. So because everything should be covered, packed in a very gift wrapper, saying that you have to sell your product. So packing and labeling people, you have a wonderful career if you are understanding the brand marketing, digital marketing, creation of animations, creation of graphical things with your product. One image should showcase all your product, all your services. So then you are perfectly in the right place. You have a wonderful future. So people are being paid lakhs of salary for this kind of jobs. Yes.
So
I think I have answered that question.
yes. The next question is B pharmacy enough for hospital pharmacist?
One more time, this question is a complex question, conflict question. I can't say yes or no, because if I say yes, then pharmacies will have an issue. If I say no, B Pharms will have an issue. So to avoid this conflict, I would say that B Pharms are being working as a clinical pharmacist. We have to accept that sad truth till now. But government has given, PCA has given that PharmDs can work as clinical pharmacists. Going forward, it will be a PharmDs who can work in clinical pharmacist.
Yeah. Next question is how to get internships while the colleges are closed due to pandemic.
So this one more time, I'm really confused with the people why you are sitting at homes when you are not doing a research. So internships also are being made work from home. As I said, 30 plus, 40 plus students who are working internship under Clinosol are working from homes. So you don't need to travel to get an internship. So if a company is giving a paid internship or unpaid internship, you go for it. Even Clinosol has given paid internship to some brand marketing team members and MBAs from MBA pharma background. So you have opportunities about internship. You just have to do it. Follow us on Clinosol. You will get lot of internship openings, and probably Riper always can contact us, and we will be happy to give more internship to Riper students.
Sir, there is one compliment too. Thank you, sir, for taking India pharmacy placement in new direction.
Thank you so much. I need to thank to Dr. TV Narayana sir and Sheshasai and all central committee members of IPA who have made this initiative, and companies are looking for good jobs. So don't get depressed, don't get distracted, stay at positive vibes, people. So if you have some sessions which motivates you, please get motivated. So no one will come and make you motivated.
Thank you, Dr. Mujibuddin. Thank you very much for your wonderful sessions and for your patience answering for the queries, especially from the student participants. And sure, definitely we'll call together. Thank you very much.
Sir. Musibuddin, sir.
Yeah.
The next question is, I'm a diploma passed out student pursuing PharmD. What should be my next step to upskill and get placed as a fresher and a company for absorbable product?
Yeah, I think this is a wonderful question. PharmD currently pursuing, and how can you upskill? So keep on attending the live webinars, keep on attending the sessions with industry experts, keep talking with industry people, and keep doing searching for internships and searching for opportunities. And always Clinosol and IPA is always there to support and to bring up the things. Main focuses of you should be on writing skills, communication skills, presenting skills, and soft skills, and logical thinking. So start reading some good books, start reading some good articles, start reading about the latest technologies, start reading about the international regulations. So don't stay at Indian regulations, start speaking about international regulations. Maybe it is EMEA regulations or MHRA regulations or CFR regulations. So always try to update yourself. So updating is not one day work. It's always a day in, day out work where you keep on improving yourself. You can always mail us or message us if any of the materials, if you want, we are happy to give you. And we are happy to help you at any point of time. Please start working on this 4 lines: communications, writing skills, verbal communications, and presentations, and logical thinking.
So once the students register in the portal and they suppose 1,000 students are registered for the same job, what will be the screening process for getting that particular job for what they registered?
Yeah, so now here I will give you the real-time situation how we have made this possibility, because I was working with so many companies and so many HRs. So what is the HR's requirement? I'll tell you. I'll tell you, the students also will understand what is the actually on what basis HRs will hire the employees. You will say hundreds of answers that I gave interview super good sir, but they have not hired, and all those things you will tell. So I'll tell you the reasons why HRs will not hire people or HRs will put on hold. So reason number 1 is the location specific jobs. So maybe if a Hyderabad based CRO has given openings, in that sense, they will be probably putting a word saying that Mujib, I need people from Hyderabad location or surrounding of Hyderabad location or Andhra location. Now, if a hospital is asking for a CRC, now they have said that, okay, I want a CRC in a Bangalore location. And they will strictly say that this CRC should be a local language professional, because you need to go and talk to patients and collect the data in Kannada. Patients, we cannot expect the patients to talk in English. So, but some IT companies will probably come and say that, okay, irrespective of location, I want all the location people, because we are the company, we are a corporate company, we will give everyone. Some companies, for kind of a jobs which are needed for males, for example, some companies have said specifically I need males only, Mujib, because it is a late hour jobs. Then they have given that filter also to me. Some companies may give a filter saying that I need a PharmD only, I need a B Pharm only, I need a M Pharm pharmacology only. That is one more filter for me. Some companies may come and give me saying that, okay, I need a passed out year of this year only, 2020 only. Some companies come and say that, okay, I need a person who has really worked on literature works. They have submitted some articles, 4 or 5 articles. Then that is filter for me. So like this, we have so many filters. I will get the data, whole data into Excel format. I will be filtering the data, and I will be initially screening the resumes based on the HR's requirement. So now here, the time for HR is reduced, and we are marketing that to HR, saying that you don't need to worry. What is your requirement? You clearly stated. We will filter that resumes and we will give that resumes to you. So it doesn't mean that the other candidates are not capable. It is only the filtering options, what the HRs are asking and what HRs are targeting. Now, if it is a medical writer job, they'll probably ask saying that, okay, Mujib, I need a person who has already written a literature and who has a PhD and who is having some 1 year of experience in academics. So I will only take them into consideration. Some companies come and ask, very openly they have asked us, I don't want to name the company. So they said that, okay, trained and certified people in clinical research professional or pharmacovigilance, I want the professional. So I don't want to take a raw freshers, then certified freshers I wanted. So we'll filter in that way also. So there are so many filters based on this criteria. We filter it and we give the openings to or resumes to the companies. And the rest of candidates will always be there in our database, and we will be always doing that reshuffling, and we will be giving it to the other companies also. So all over India, we are going to companies and we are collaborating with companies so that one-stop solution, if they want any jobs, they can contact IPA placement and we will be able to give the jobs to them. So there is no doubt about it. So this is one-stop solution.
Okay, so I think that's all the questions for today. Thank you so much. Just you added some importance for this particular IP Annual Convention 2021, and you backed in most of the interest of the students too. Thank you so much for being part of this program, sir. Ramalingam, sir. Ramalingam, sir. Okay, there is a couple of questions, sir. Shall I take that?
Yes. I'm open for questions. We should not leave questions, or else students will feel bad, maybe.
Do your company has any interstate pharmacy training digital and skill program?
Answer is currently we are working remotely, and we have students across India, Europe, US, and Bangladesh, and Canada also. So we have students across countries and across states also. So we don't believe on offline classes. That's what we just said. We believe on upskilling and reskilling of the people with industry experts. So we have across India and across the borders also, across different countries also.
Yeah. Next question is, I'm doing masters in pharmaceutical analysis. Which among the works specified by you in the clinical area is best suited for me?
Yeah, I think up to me, the answer is you can go into bioanalysis research if you are looking at specialization level. But if you are thinking about going into other jobs also, companies will not be asking specific to qualification. They will be asking like, I need an MPharm. They will not be asking like, okay, MPharm analysis only, pharmacology only. No, So the MPharm is MPharm for a corporate companies. Now that much specialization thinking they have not came up. When I spoke with corporate companies, maybe Cognizant or maybe IBM or Wipro, they have not started thinking that they are asking for specialization. You can go into any of the field. MPharm is MPharm. So there is no difference of the specialization because we have studied MPharm, but if you want to go specialization jobs, bioanalysis, R&D sections, wherein we understand the pharmacokinetics of the drugs by giving a drug and we take the blood samples from the subjects, human beings, and we do a lot of research on the blood samples by using LCMS or HPLC, you can go into that job if you are specifically looking into your specialization. But rest of all jobs is good for you. Even brandings or clinical research or data management, data scientist, all jobs are good for you.
Your next question is, during this pandemic, which side you suggest to the students, like taking industry or pharmacovigilance or clinical research?
Yeah, I think this is a conflict of interest question because Clinosol is providing all this training. So I cannot tell this answer. So Clinosol provides clinical research and pharmacovigilance and data management and clinical data science trainings and SAS trainings and medical writing trainings. So I cannot suggest any other organization name because this becomes a conflict of interest for me.
And there is one message for you, like such a great informative session. Thank you so much, sir.
I'm very thankful that students have finally liked the session because always session before lunch will be always a challenging. People will be run away and people will be run away if the session is last session also.
There are a lot of messages thanking you, sir, and along with that, you added good information, like nice information, sir, like that. Thank you for the updates. Like so many messages are there from the student side.
Yeah, I'm indebted, guys, and please motivate yourself. Please create your LinkedIn profiles. Follow Clinosol. You will find out so many jobs in Clinosol. We will be having collaboration with companies. You can upload your resumes to IPA placement portals. You can follow and you can see what new programs or new things you can learn. And please do attend the industry experts live sessions next week, Saturday, PV webinar. Try to motivate yourself, and there are huge number of jobs. There is no doubt. Companies are ready to hire people like anything. So today also morning I had a discussion with a company. So, but never ever expect high-end salaries, huge salaries at the initial levels. Start with a salary and learn things. Money will automatically come back to you. So I'll tell you a simple story that when I started my career, it was very less salary. When I was working in IQVIA, it was a kind of a very good amount of a salary as a pharmacist we get. And we should be really proud enough that as a pharmacist, we have done so much of things. I'll tell you this thing that I was working in Oracle. And when I was working in Oracle, so under me, there were so many engineering people who were reporting to me because they don't know what is the data means to them, what is clinical research means to them. So we are the people who knows about what exact data is needed for the drug or a vaccine to show its efficacy and safety and how best we can bring the molecules to a market. And we should be capable enough. And I have given so many sessions for a lot of the people. So please be motivated as a pharmacist. We need to be proud enough to say that we are a pharmacist and we are not less than anyone. We have done so much of research. We have done so much of articles and we have done so much of work.
Okay, so that's all the questions.
Yes.
Thank you so much.
Thank you.
I thank the today's speakers, Mrs. Manjri Sandipgarar, and the panel discussion with Dr. Amit K. Tiwari, sir, and the placement conclave by Mr. Muzibuddin, sir, for making your time for us. Thank you so much. And that's all for today's morning session, and afternoon we'll join by 3 o'clock for valedictory and the most awaiting event, that is prize distribution. And so thank you so much for all the participants and for all the dignitaries making this morning session a wonderful platform for us. Thank you. Thank you, Muzibuddin, sir.
Thank you so much. Thank you.
So, okay, we'll meet in the valedictory by 3 p.m. Desai, sir?
Yeah, I'm there. Tell me,
Yeah,
ma'am.
yeah.
Shall we close it?
Yeah, yes, sir.
We'll end the meeting. Okay.
Yes, sir. Thank